Well, as you know, your smile is one of the first things people notice about you, right? And if you're hiding your smile because of receding gums, guess what? You are not alone. There is a way to solve that problem, and it's not as painful as you might think. I want you to meet Dr. John Chow, and with him is Dr. Eric Svans. They're joining us this morning, and we're talking about receding gums. You know, they don't affect just older people anymore. It affects everybody. Dr. Chow, tell me about how you used to fix receding gums.
The way we used to fix it was we have to cut a piece of gum from the roof of the mouth. And then cut the gum where we want it, and then stitch it to the new place.
I can't even fathom having something like that done. But receding gums are not only unsightly, but they can be actually very dangerous for us, and tooth decay. How did you come up with this new procedure?
Well, it was such a the necessity of it drove me to want to do something a little bit better.
We're actually looking at an animation here of how this works now.
That's where the tissue is being taken from the roof of the mouth and then transferred to the area that's needed.
That's the old way.
Yeah, and that's stitched up like that. With a new way that I invented, we have a pinhole there, and that we make with a very tiny needle, and then we have specialized instruments that basically lifts the tissue up from the bone.
Okay.
And then basically we'll drape it down. And then we'll put some collagen underneath, and that stabilizes it. So when it's done, you can hardly tell it's done. There's no sign of actual surgery being done. Because there's no stitching, there's no cutting that we have to do any stitching for.
That's amazing. So the recovery process, night and day.
It's hardly anything.
Hardly anything.
They can have lunch or dinner afterwards.
No way.
And they come back the next day, the pinhole's gone, and they take 1 or 2 Advil sometimes, and that's it.
And they give you a big hug, is what you said, right?
Yes, this is a new dental procedure. It's a huggable procedure.
A huggable procedure.
We get a lot of hugs for that.
Amazing. This is amazing. Now, Dr. Chow, you live in Los Angeles and you invented this procedure. Yes. And Dr. Sven, you are actually performing this procedure at your office.
Yes, I am.
How many procedures have you done?
We've done over 50 to date.
Wow. Okay, now the old way versus the new way. Tell me about some of your patients when they come in. First of all, how do you, or why do you get receding gums to begin with? Is it genetics?
Genetics can play a role in it.
Okay.
Many times it's from overbrushing. Many people brush wrong or with the wrong type of toothbrush.
Really?
And many people clench and grind.
Ah.
Those are the most obvious signs that we see that have caused the recession.
You know, when you go into the dentist and they're counting, you know, they count. Is that what they're talking? Is that what they're counting, or the gums?
That's part of it.
Okay.
They're actually measuring the pocket depth. But what we also measure is the amount of recession. Okay. That's an additional reading that we usually take, yes.
Okay, all right. So when somebody comes into your office and they have this procedure done, is it something that you do it in your office? This is not necessarily, I mean, are you putting people out? Or?
No, just local anesthetic.
No kidding.
Just like we were doing a filling.
Wow.
Or anything else.
I want to take a look at some before and after pictures, and maybe, Doctor, you can describe to me, you know, what we're seeing here. The before picture, clear, it's that line that you're seeing above your tooth enamel.
Yeah, this patient couldn't smile, and when she did smile, she wanted to cover it up. And so in one session, less than an hour, I was able to bring the gums down to where it is, and she actually cried when she saw it.
Oh my gosh.
She says, you know, I'm so grateful, and then her family tells us that she's totally changed, that she's happy, she's smiling. That she's back to where she was before. Her husband was delighted with it. This is another case. This young man came in with a lot of recession, and then we brought it all down in one appointment. He was just totally happy, and 6 months later he was married.
So it really worked for him, didn't it?
So I see his kid now. He says, I'm responsible partly for that.
Oh, that is adorable. Now, Dr. Sven, when people come in, I mean, you can clearly tell by looking in the mirror. You know if you have receding gums or not, right?
Absolutely.
So when they want to make an appointment to have this type of procedure done, do you need to analyze and meet with them first? And
always.
Okay. Is there any good candidate, or is there anything that people should know prior to making an appointment like that?
You know, anyone with any type of recession is a candidate for this procedure. This procedure, pinhole fills a void that currently there was no treatment for it.
Wow.
Now, Dr. Spence, you have a story to tell about Mary.
Okay, we got to do
Mary,
it
hear
quickly,
that.
though. Tell me Mary real quick.
You know, Mary is my typical patient. Comes in, drove in from Mesa, recession on 2018.
Wow.
Prior to that, she would need 3 or 4, maybe even 6 surgeries to get this corrected. We're able to do this in 1 or 2 visits. No pain. Show her the mirror right after. Shocked. She's just shocked. Can't believe it.
No pain and a big hug. That's what
Absolutely.
you got, right?
Yes,
All right.
You got a huggable procedure.
Thank you so much, gentlemen. This is fascinating. Thank you for sharing this new procedure with us.
Thank you for
let me
having
give
us.
you the contact information here for, it's called the Chow Pinhole Gum Rejuvenation, and the phone number to learn more, find out any more information is 888-603-2953. The website is pinholegumrejuvenation.com, and the website for Dr. Eric Spen is the Phoenix Dentist, his pinholeaz.com.